Good afternoon, welcome, and thank you for joining us with Family Network on Disabilities. My name is Latasha Bird. I'll be your facilitator today. I'm the Multicultural Outreach Coordinator for Family Network on Disabilities and also trained with the Family Star program for families who have children with complex medical needs. Today, we will discuss emergency introduction to a 504 plan and IEPs, having those different types of information added into those documents. So today I want you to take a little minute and understand the info that we are bringing you today and share in the conversation. If you have comments or questions, or you'd like to have any of those concerns met, please use the chat box. This is a great way to share information and to understand and have clarity. Today, we'll be talking about the individual and emergency healthcare plan and IEPs and 504s. Remember, thank you for joining us here today. We're glad that you showed up to find out a little bit more information about a topic that you may previously not have known very much about. Please use that comments and chat box that function here right to the side of your screen or to the bottom, depending on what type of device you're watching us from, and help us to help you. Let us know what concerns and comments you may have about today's webinar. We are a nonprofit 501c3 parent training and information center for the state of Florida. We are family driven and family centered, and that's one way that we are able to bring our shared experiences and learned experiences, as well as caring and empathy to all of the workshops that we present for families and organizations. Now, we want to make a perfect clarification before we get started. We are not formal attorneys or doctors or either mental health professionals in the formal sense. However, we do provide information and resources and support to families so that you can make informed decisions about your loved one's healthcare needs and educational and also community involvement needs. So again, we will say once more, thank you and welcome from all three of our regional PTIs and the Family Star program that you see listed at the very bottom. Let's go ahead and get into the webinar. You're here today to talk about IEPs and 504s, but this is going to be a little bit different. We're talking about having an emergency healthcare plan added into that document. With students with disabilities, they receive appropriate educational services that may include services as a result of three primary laws. Let's talk about all three of what those are. There's all the three. IDEA, the educational benefit, the 504, equal access of federally funded, and also ADA, that's the Americans with Disabilities Act. So let's talk about the first one, IDEIA, the educational benefit. So children who qualify under at least one of those 13 categories for disability within IDEA. Also the 504 was equal access if federally funded, but all children who meet 504 definition of disability, and that includes those who qualify under IDEA as well. And also with ADA, there's equal access regardless of funding. So all individuals who meet ADA definition of disability, regardless of their age. So let's talk about what an individual health plan entails. So this is going to be a formally written agreement. It's developed with the interdisciplinary collaboration of a couple of people. That's the school staff, also in partnership with the student's family, the student, and the student's healthcare provider or providers if there are multiple. So this health plan is going to be written and developed through a team effort. So this is what your healthcare plan may look like. This is a good time to take a screenshot because depending on what device you are watching us from, this writing may be very, very small, but this may be a good representation of what the school individual healthcare plan will look like. It has several different aspects. Let's go ahead and try to see if I can make this a little larger for you so you can see. So there's a school individual healthcare plan, has basic things that you would see here: the name of the student, condition that they have, class that they are in, and whether or not they require nursing assessment or classroom modifications due to a health condition. So these have what triggers they may have, along with the condition, a little bit more of a detailed type of aspect here. And then there's a plan to send to the nurse for assessment, allowed to monitor their own activity, or rest for the day, slow down when should you call 911, and other options that you may have to be aware of. Also, I'll take it back down a little bit with this first column. That's the first, that was the what column. Then when has a column as well, and a why column, and then who should be involved. That's by whom. So these are, this plan will show, depending on what it is that will happen, when it happens, why you will, why it is happening, and what should happen with the person who is administering the care, and who that person is going to be that is actually administering that care. So this document will be inserted into that plan, has all the information as well as the parents' information and emergency phone numbers that you may need to contact as well. There's a signature and a date at the bottom, and finds out who is preparing it. So here you see in this representation, this will be the doctor or a nurse, and their credentials added at the very end. So this is one of the things that you may see with that school individual health care plan. It's going to be added into the documents of the IEP 504. So again, what is an individual health plan? Well, everything should be made as simple as possible, but not simpler. So with that being said, we want to show how this document is actually comprehensive, but it doesn't have so much information that it overpowers the need for what the document actually stands for. It wants to be comprehensive. You don't have to reinvent the wheel, but at the same time, you want to make sure that this individual health plan details all of the ins and outs as to what you're looking for, when you are looking for this, the different types of action, who to call, what action should be taken, and how to resolve those issues. Everything should be made as simple as possible, but not simpler. Make sure that everything that you need is inside the document, but don't oversimplify what you need as well. So these are different ways that you will see the individual health plan, IHP. This can also add in these types of situations where families are able to show those needs of the children and actually have those actionable different types of excuse me, those actionable plans added into that document as well. You see right here with pictures, and it shows what the classroom may look like within that set. So here, a good IHP will contain information. It's going to contain guidelines, going to have standards that promotes the student's health. It also has standards that will promote educational goals. You saw all of those other different aspects of what was in that document that I enlarged for you. That is one of the documents, and this will be added in within that plan. So when you have a good plan, it's going to have all of those aspects that we talked about previously, but also have those guidelines and standards that would need to help promote the student's health and their well-being while they're at the school, and have those educational goals and needs also added in. So one of the things that you may want to avoid would be unnecessary risks, also restrictions, stigmas surrounding the condition, illnesses, and also absences. You won't have all of those different types of things to add into the document. You want to make sure that it is clear and concise, but not oversimplified, as we talked about on the slide a little bit previously. So here are going to be a couple of examples of health-related needs that you may require an IHP. That's the health plan, this individualized health plan. So if your child has, you see these different pictures right here. The first, that EpiPen, if your child has asthma, this may be one of the health-related needs that may need to be administered and require an IHP within that document, so that the person who would be able to administer it, all of those aspects can be delineated in that document. You also may want to consider if your child has serious or very severe allergies, medication needs, and chronic conditions as well. Even if your child has ADD or ADHD, needs medication, these may be health-related needs that may be that may require that IHP as well. Also, if your child has chronic conditions such as physical disabilities, catheterization, and also assistance with toileting, those are also health-related needs that may require an IHP. So it's a good idea to understand your child's condition and how those caregivers, especially in an educational sense, would need to have those aspects outlined for them, for your child, as they would be required for not only in an educational setting, but for their general health and well-being as well. So these are few examples. There may be more, but these are just one of the few examples that we want to give you for health-related needs that may require an IHP at that school. So there's also an emergency action plan, that's an EAP. So if you have an emergency action plan added into that IEP or 504 document as well, these are going to be a couple of things that you want to consider. When would you actually need one? And that's when the healthcare condition has a potential to progress into a medical emergency or a crisis. You may have a situation where 911 might need to be called. You saw that on that document a little bit previously. So who determines what that need is going to look like? When a health condition has the potential to progress into a medical emergency or a crisis, a lot of times the persons who would determine that need look like a school nurse, could either be a parent or even the student himself or the medical professional. These are just ways that you want to have written out what that action plan is going to look like. Remember when the document had what the condition was, what to look for, who would administer medicines or any type of other actionable reactive responses to the condition or for the condition, and also who that person would be. And if need be, would 911 have to be called? So this is the emergency action plan. And remember, this is going to be also an addendum to the IEP and 504 plan. So there are incidences where an EAP may be needed. So think about all of these different types of things. So in some districts, you cannot have any types of snacks that contain peanuts, because some children have severe peanut allergies, and you're not able to bring any of those types of snacks or related items for consumption that have peanuts in them, peanut oil, peanut, any type of paste, peanut butter, no peanut butter snack, all of those different things, because some kids have peanut allergies and peanut snacks are not allowed. So these can be some instances where an EAP might be needed. If your child has peanut allergies, severe asthma, epilepsy, diabetes that is insulin dependent, and also children who have mental illness, and you see here in quotes, meltdowns, can be one way, a few of the incidences that where you may need an EAP. So remember the screenshot of the listing that we showed you a little bit before. It had a lot of those W questions: who, what, when, where, how, why, how, who. All of those questions were on there, and these were the ways that you want to understand who in all of those answers could help in those instances should they arrive. So this is one of the ways that we want you to understand that within that plan, it must describe all of those different types of aspects. We want to have those W words actionable. You need to have them enumerated, delineated inside that document, so you cross all your T's, dot all your I's, and understand how to make that plan actionable. So an emergency action plan is going to describe all of those different aspects. So if you think about when you are developing that plan, this is what it's going to look like. So think about when you're developing that plan, if you have any of these aspects that we had spoken of before, what are the actionable things that you would need to ask and have answered in each one of those instances? Your child has insulin dependent diabetes and their blood sugar has gone very, very low. What would you need to do? Who would you need to contact? What would you need to do? What do you need to look for? What are the signs? Who, if you needed to dial 911, what facility would they have to go to? Could they administer medications at that time? Where is the medication? Who has the medication? Would you need to call a parent? All of those different types of things. When you are developing that EAP, answer each one of those W questions and understand what the action needs to look like as it is progressing. This is where you want to think of your parental participation. As a parent, we are the foremost authorities on our children. Your participation is key, it's paramount. You have to understand how to make sure those needs are met and they are actionable and written in such a way that it gives them a detailed roadmap of how to respond in kind to situations where your children would need medical care in your absence, and especially in those places where there are educational setting. So parents have information, they have the information about their child, and they have to share the information because it's important, even though it's not required. Parental participation helps with those special instances where your child may need a little extra care, and you understand best how that care can be administered. So in any instance, we ask that parents be as involved as you can. And if there are any times where you don't understand how to voice those concerns, or even if you needed someone to help guide you through the process, Family Network on Disabilities is here to help. That's one of our models. We help our families to become more informed parents. We help our families to understand what those processes look like with healthcare and with education, and help to bridge those gaps between your family and community involvement, as well as educational and medical processes. So if at any time you would ever need to find out more information about those processes, please don't hesitate to reach out to the Family Network on Disabilities. If you had further questions or anything that you would like to ask us, this is a great time to use that comment box. And also I'll put in an email address if you would like to ask your questions in a more formal sense and not have information on an open forum. We'll put an email address and a telephone number that you may be able to call us to find out more information about those respective topics, and also help us to help you give us an evaluation of our workshops and help us to add in more information should there be things that you would like to see added in, or new workshops on certain topics that you may not have seen previously with us. Help us to help you by signing an evaluation, filling it out. Doesn't take very long, maybe 2 minutes. It's a great way to help us to facilitate our outreach with the needs that you would be that would be specific to your family situation. So on behalf of the Family Network on Disabilities, all three of our regional PTIs and the Family Star Program, I'm going to say thank you again for joining us. We invite you to visit our website at www.fndusa.org and also visit us on our social media channels. All three regional PTIs have Facebook pages as well as group pages, and also with Instagram and Twitter. This is a great way to help facilitate those conversations in a manner that has information that's easily digestible and in a way that's digitally optimized. And with that, I just want to say thank you again for joining us here today for our informative webinar. Should you have more questions and you'd like to contact us, you can do so by dialing 1-800-825-5736. Again, that number is 1-800-825-5736. And we wanted to say again, thank you for joining us today for understanding what emergency healthcare plans look like as they are added into IEPs and 504s. Thank you so much for joining us here again today. My name is Latasha Bird. I've been your facilitator. If at any time you need more information, please reach out to the Family Network on Disabilities and we can help facilitate that request for you. Have a wonderful day. Bye.